Today, I'm gonna show you the different types of anatomical movements. This is the correct anatomical position. Flexion and extension are known as angular movements. Flexion decreases the angle between two structures as they bend or move closer together. Extension increases the true angle between the two structures as they straight or move farther apart. I will give you some examples of flexion and extension. Elbow or forearm flexion. Making an angle between forearm and increases as arm moves toward humerus bone. In contrast, elbow or forearm extension is an angle between forearm and arm increases as ulnar moves away from humerus bone. Shoulder or arm flexion. Shoulder or arm extension. Knees flexion and extension. Flexion, extension. Abduction and adduction. Abduction is a movement of a structure away from its midline reference point, while adduction occurs as the structure is added back toward the midline reference point. Always remember, this is our midline reference point. Example, when your arms move away from the midline point, it is adduction. And when your arms move back toward the midline point, that's what we call adduction. Thigh adduction, when your lower limb moves away from a midline point, and thigh adduction is when your lower limb adds back toward in a midline point. Medial and lateral rotation. Medial rotation is a rotational movement toward the midline. In contrast, lateral rotation is a rotating movement away from the midline point. Arm medial and lateral rotation. Medial rotation. Lateral rotation. Elevation and depression. Elevation is a movement in superior direction, while depression is a movement in an inferior direction. A good example of this is the shoulders rise. Elevation, depression. Pronation and supination. This is quite different from medial and lateral rotation. The only thing is, you have to keep your shoulder and elbows in. Turn your hands onto its supine position from up. This is supination movement. When you're turning your hands onto its prone position, palm down, is pronation. Dorsiflexion and plantar flexion. This describes movement of the ankle. Dorsiflexion is a flexion of the ankle which foot points in superior direction. Plantar flexion is an extension of the ankle which foot points in inferior direction. Inversion and eversion. These movements occurs at the joint of the ankle. It is when the foot rotates around its long axis. Inversion is when the sole moves toward the medial direction. Eversion is when the sole moves away from the midline point in its lateral direction. Opposition is bringing together the thumb and the little finger is a conical or circular movement in a cone form by extending the limb from the joint. Shoulder circumduction, thigh circumduction, ankle circumduction, wrist circumduction. Protraction and retraction. Protraction is moving your scapulae or shoulder blade forward into the side. Retraction is the opposite of which moving your scapulae back toward to the middle. Protraction, retraction.